So some of my most viewed videos on this app are videos about complications that happen from surgery. In particular, my videos about seromas and necrosis. I get DMs multiple times a week, people emailing me because they have in particular problems with seromas and they're not getting help from their surgeon. So first and foremost, if you have a complication from your surgeon should be helping you with that. And if you are being forced to DM a surgeon, that is not a good sign that you have an ethical surgeon. Now, when patients contact me, they almost always have a surgeon that is from one of two places. Place number one is someone that's very far away from them, usually overseas or Florida, and they cannot afford to go back to where they had surgery, or that surgeon is not willing to see them. Number two, they came from a chop shop, so a budget clinic, high volume, low cost, chain plastic surgery places. So I always say this in videos, it's very important if you're gonna have a surgical procedure that part of the conversation with the surgeon is, what happens if I have a complication? Because it's extremely important for you as a patient to know what to do, where to go, and who to ask for. Because it breaks my heart that people are in my DMs asking for help. I can't help you in a DM. It's really a horrific thing for a patient to experience, and this is something you should talk to your surgeon about before surgery. The next thing I hear a lot in my DMs is that patients will tell me that their surgeon is telling them that this is out of their scope of practice. Seroma, necrosis, infection, this is out of their scope of practice. That's not true. Literally anything that happens after surgery is in our scope of practice. We manage good surgeons manage everything that happens after surgery. And if it's something we need help with, we get help, but we're right there with you. So no surgeon should abandon you with a surgical complication. In fact, they should be the one calling and getting consultants to help you, not you. So again, it makes me sad that so many people experience this. I just can't give advice in DMs. It's not safe. It's not legal. Just make sure that if you are planning to have a surgery procedure, you think about the what if something happens. Because when everything goes great, great. You can teach anyone to operate, but you can't teach them how to manage complex complications or how to be a good person. So make sure you ask those questions before the scalpel gets pulled out.